Hi, my name is Hayley and I'll be your nurse today. How are you?
I'm good. How are you?
Good. Can you tell me your full name and date of birth?
Kira Taylor and 060797.
Good. Can you tell me where you are right now?
I'm in Old Orchard Beach.
And do you know what time it is?
About 9:30.
Good. Patient is alert and oriented ×3. Are you experiencing any pain right now?
I am not. No.
So on a scale of 0 to 10, 10 being the worst, 0 being nothing, you
0.
say 0.
Yeah.
Okay. I'm going to give you 3 words right now, and I'll ask you to repeat them back to me, and then in a couple of minutes, I'll ask you to recall them.
Okay.
Your words are blue, sock, and bed.
Blue, sock, bed.
Good. I'm going to wash my hands and put on some gloves. Is it okay if I look through your hair?
Of course.
So I'm assessing your hair for distribution. If there's any critters in here that aren't supposed to be, if there's any flaking, everything looks clear and clean. Good. I'm going to take off my gloves. Your head is round, fully formed, no deformities. Do you use any assistive devices?
Just my glasses and contacts.
Okay, no hearing aids, walkers, canes.
Nope.
Okay, good. How would you say your eyesight is with your glasses on?
Pretty good. Yeah.
And what about without your glasses?
Pretty bad.
Okay. I'm going to start with the 6 cardinal fields of gaze. So for this, you can leave your glasses on.
Okay.
Just follow my pen light without moving your head.
Okay.
Good. And I'm going to test accommodation. Perfect. Can you tell me what those 3 words are?
Blue, sock, bed.
Good. Patient's short-term memory is intact. I'm going to turn my light on. If you could look straight ahead, not at the light, and I'm going to test the reaction of your pupils. Good. Good. So your pupils are equal, round, reactive to light, and accommodating. Now, if you wouldn't mind taking off your glasses, I'm assessing the color of your eyes. Your conjunctiva is clear. Your sclera is white. Your iris is a good coloration all the way around. Your eyes are symmetrical, fully formed, even. Your eyebrows are symmetrical, fully formed. Your eyelashes look healthy. Good. And now I'm going to look in your ears. I'm assessing for any drainage or deformities, which I don't see. Good. Do you have any trouble hearing?
No.
Okay. I'm going to do your peripheral vision.
Okay.
So,
Do you want my glasses on or something?
oh yeah.
Okay.
Yeah.
Sorry.
Thank you. So when you see my fingers, just let me know.
Okay. There.
Awesome. And now I'm going to perform a whisper test. I'm going to come back behind you and whisper a word and let me know what you hear.
Sock.
Good.
Giraffe.
Awesome. I'm going to assess your facial cranial nerve, so if you could puff your cheeks out for me. Good. And smile. And frown. And stick your tongue out. Raise your eyebrows. Good. Patient's facial cranial nerves are all intact. Do you have any problems smelling?
No.
Can you block one nostril and breathe in? Good. And block the other one. Breathe in. Do you feel any blockages?
No.
Nope. Okay, good. Your nose is midline, fully formed. There's no drainage. It looks normal. Now I'm going to look in your mouth. If you could open and say, ah. So your uvula is midline. Your tonsils are not inflamed. They look healthy. There's good moisture. It does not look dry. Your tongue is of good coloration. Your lips match the inside. Your teeth look very healthy. I don't see any odor. Everything looks good. Now I'm going to feel your sinuses. If you feel any pain, let me know.
Okay.
These are your frontal sinuses.
Nope.
and your maxillary sinuses. Any pain? Nope. Good. Now I'm going to feel your lymph nodes. Again, if you feel any pain, let me know. This is your post-auricular, submandibular, cervical, subclavicular. Any pain?
No.
Okay, now I'm going to feel your trachea. I'm going to make sure it's midline, which it is. If you could swallow. Good. And I'm going to feel for your thyroid. And it's not palpable, which is good. Now I'm going to assess your skin. I'm assessing for color, temperature, moisture, any deformities or rashes, which I don't see. I'm going to look at this arm as well. Skin is appropriate for ethnicity. I want to make sure that it matches your skin down here. Good. It is warm and dry, but not excessively dry. I'm going to do a Turgor test. This is testing hydration, and it bounces right back, which is good. And I'm going to do a cap refill test, and it has returned within 3 seconds, which is good. Your nails are smooth, no ridges, bumps, no excessive angling of the nails. Good. If you could stand up for me, and if you could walk to this wall and back, I'm assessing your gait and posture. Posture is erect. Doesn't look like you have any difficulty balancing. Now I'm going to perform the Romberg test, so if you could stand there and close your eyes, I'm going to make sure you don't fall over. I'm assessing for any swaying, which doesn't seem to be present. So good, you can open your eyes. Can you follow the motions that I do? I'm assessing range of motion, so if you can lift your arms up and down and forward. Good. Can you press up? Good. And can you do kind of like a around the world thing? Good. I didn't feel any cracking or crepitus. Can you do the same thing over here? Good. Any pain?
Nope.
Okay. I'm going to test this joint. If you can move your elbow up and down. No crepitus. Any pain?
Nope.
Good. I'm going to do the same over here. You can. Good. I'm just going to wake this up. Can you press up on my hands? Good. And down. Good. Can you move your wrists? And side to side, all around. Good. Any pain? Cracking?
Nope.
Okay. Can you press down on my hands? Good. Strength is equal bilaterally. And squeeze my hands. Good. Same here. Strength equal bilaterally. I'm going to assess your fine motor skills. So if you can touch your fingers to each other. Good. And I'm going to assess your gross motor skills. So if you could put your hands on your legs and flip them back and forth. Yep, just like that. Perfect. And now if I could have you bring your heel up your shin. Good. Patient is balanced on the other one. Very good. Now I would like to assess your spine. So if you could bend over, pretend like you're diving into a swimming pool. I'm feeling your spine, if there's any abnormal curvatures or bumps, if you have any scoliosis, which it doesn't seem to be any problems here, so you could stand back up. You can have a seat. I want to assess the rest of your joints, so if you could move your head back and forth this way. Any pain?
Nope.
And if you could do forward and back. Any pain? And I'm going to test the resistance, so if you can press your head against my hand. Good. And this side. Good. Can you bring your knee forward for me? Good. There's no cracking, crepitus. Any pain?
Nope.
All right. Same over here. Good. Can you press forward on my hands? Good. And pull back. Good. Can you press up on my hands with your feet and press down? Good. I'm going to feel for your pulses. I'm going to feel your pedal pulses, your posterior tibialis. Good. Your radial pulses. Good, they're equal on both sides. And your carotid pulses. Good, it's strong on both sides. Good. If you could lay back for me. Is it okay if I assess your bowel sounds?
Yep.
So I'm going to start in the right lower quadrant. Good. Bowel sounds are active in all 4 quadrants. Now I'm going to listen to your aortic valve. And renal. And iliac. Good. I don't hear anything like Brutes, which is good. Do you mind if I palpate your abdomen? I'm assessing for any
Sorry.
any lumps or bumps, masses, any herniation. Do you feel any pain?
Nope.
Abdomen looks good. The color is normal. There's no barrel chesting. So you can pull your sweater back down and sit up. I'm going to assess for TMJ. So if you can open and close your jaw. Okay, so I feel some cracking. Is that a normal thing for you?
Yeah.
Okay. I'm going to listen to your heart and lung sounds.
Mm-hmm.
So I'm going to start with your heart. I'm going to listen with the diaphragm first.
Okay.
This is aortic. Pulmonic. Herbs. Tricuspid. And mitral. Good, and now I'm going to listen with the bell. Again, this is aortic, pulmonic, herbs, tricuspid, and mitral. Good. And S1 and S2 heart sounds are present. Now I'm going to listen to your lung sounds. Every time I move my stethoscope, if you could take a deep breath in and out.
Okay.
Good, your lung sounds are clear. Now if I could have you turn this way so I can listen to the lungs in the back. Deep breath in. Good. The lungs sound clear, and they're the same on both sides. I'm going to test for chest expansion. So if I could have you take one last deep breath in. Good. And out. And my thumbs moved apart. There's good chest expansion present. Now I would like to test your sensation. So if I could have you close your eyes, I'm going to touch a part of your body with my pen light and just tell me where it is.
My right shoulder. My left elbow. My right hand. My right knee. My left foot.
Good. You can open your eyes. If I could have you lay back one more time.
Mm-hmm.
Sorry, I just want to make sure that your joint here is good. If you could lift your leg. Good. Any pain?
Nope.
On this side? Pain?
Nope.
No cracking or crepitus? Are you able to lift both your legs and push up? Good. You can sit back up. I'm just trying to think if I've forgotten anything. Do you have any questions for me?
I do not.
All right. Thank you.
Thank you.